Good morning, everyone, and Happy New Year. Welcome to Munson Healthcare's COVID-19 press conference. Today is Tuesday, January 4th, and my name is Diane Mihalik. I am the Chief Marketing and Communications Officer for Munson Healthcare, and I will be your host today. Before I introduce today's speakers, I just want to remind you that we will be having a Q&A session at the end of the speaker presentations today. If you are a reporter joining us on the Zoom call, you can submit your question via the Q&A feature. And if you are joining us live on Facebook, we're happy to have you watch, and you can submit your questions through Facebook, and we will answer as many as possible as time allows during our 45 minutes that we have today. So joining us today will be two speakers. You'll be hearing from Dr. Christine Nefcy, Chief Medical Officer for Munson Healthcare. And then we're happy to welcome back Dr. Nick Torney, who is an infectious disease pharmacist with Munson Healthcare. So let's get started. And I'd like to introduce Dr. Christine Nefcy to give us an update on our current case numbers and hospitalization rates. Welcome, Dr. Nefcy.
Thank you. And I'm going to have somebody start my camera because I wasn't the one that turned it off.
Okay.
But we can go ahead and start with the numbers. You can see here for the state of Michigan, we are seeing quite a high positivity rate. So the 14-day average, and as a reminder, we look at the 14-day average because that sort of tempers any fluctuations we might see given a weekend or a holiday or that kind of thing. But we're at 25.8% for the state. The daily average there is 32.9, which is typically an indicator that that number will be going up. So quite a high positivity rate. And then you can see also for the state that we had a pretty significant increase in just numbers over the last 4 days. If we go to our numbers regionally, we did have a nice little respite, a Christmas present of a lowering rate. So just before, this is 15.6% is about what we were right before Christmas. We did see a slight decrease over the holidays. That is now trending back up. So you can see there a 15.6% positivity rate on a rolling 2-week average. Our daily is 17.6. So again, an indicator that that likely is going to go up. And then you can see we are at 616 cases per 100,000, which is also an increase from where we have been over the last 2 weeks. Next slide. Again, here is just sort of that trend where you can see our peak, slow decline, and we'll see what happens over the next few weeks. But given what's going on in the state, we are expecting that number to go up. We had seen a nice trend down in our inpatient COVID cases. Again, over the last 2 weeks, today we did see an increase in that number. Next slide. And there you can see likely due to the Omicron variant, pretty high numbers across the country. We had seen a little bit of isolated elevation here in the Midwest and Michigan specifically. You can see that that has now spread across the eastern part of the United States, as well as starting to see those numbers in the southern part of the United States. So again, most will tell you that this is likely secondary to the Omicron variant, although we are still seeing quite a bit of Delta as well. Next slide. And there you can see at a national level a very sharp uptick in the number of cases. So, that increase of 65,000 cases in our state over the last 4 days is really a reflection of what the rest of the country is seeing. So very high rates. Next slide. And then, we talk a lot about vaccination here, but here you can see the completed rates for vaccination. So we are getting close to that 70%, but we have a ways to go for completed vaccination rates. Our numbers, are still led by the younger population. Our older population tends to be much more highly vaccinated than the younger. Just a reminder that all people can spread it. Next slide. And here you can see our particular numbers today. So 76 patients hospitalized, only 12 of those are vaccinated. So that's about a 15.7% breakthrough rate just of hospitalization. 32 patients in our ICU, only 2 of those vaccinated, and of our 13 ventilated patients, none are vaccinated. So again, just sort of a graphic to show you how protective against serious illness and hospitalization immunization against COVID-19 can be. Next slide. Here you'll see the case rate trends by age group. So again, as you can see, these higher numbers here are in the 10 to 30 to 39 range. So certainly what we are seeing is those members of our population that are likely the lowest risk of getting serious illness are also the lowest likelihood to be vaccinated. But again, you know, this is a very infectious communicable disease. And so we would strongly encourage everyone to get vaccinated, not only to protect yourself, but to protect those around you. Next slide. There have been a couple of changes recently. The FDA as well as the CDC have approved the COVID-19 booster dose for children. They have also shortened the timing between your second and third booster shot from 6 months to 5 months. If you have received Moderna and are 18 years old or older, you may also get a booster 5 months after your second dose. And then again, if you've received Johnson & Johnson and are 18 or older, you may also get a booster following your primary. And I think it's 2 months, not 5 months. So sorry about that one. And then you can also, as a reminder, mix and match. So there's no need to follow if you started with Pfizer to continue with Pfizer or Moderna. You can mix and match those vaccines for your booster. Next slide. We also just wanted to keep people aware. We are starting to see some influenza. Certainly our colleagues downstate are reporting some high hospitalization rates. Or higher, rather, not high, but higher. We do have a handful here in northern Michigan as well, but we are starting to see some influenza along with the coronavirus. So again, please vaccinate. And another reminder that all those other mitigation factors against infections spreading, like hand washing and masking and social distancing, will work with influenza as well. Next slide. So just to talk a little bit about the Omicron variant, we do know that the vaccines, again, are protective over developing serious illness and hospitalization, even with the Omicron variant. So we would highly recommend you continue to seek that as an option. And as I stated earlier, the other mitigation factors like masking, hand washing, and social distancing are also effective. So, you know, there are a number of safety measures we would ask that people consider and use in order to protect both yourself and those around you against coronavirus in general and the Omicron variant specifically. Next slide. So again, get your booster or get vaccinated if you haven't already. Make sure you're masking in school or other indoor settings. Masking does help prevent the spread of coronavirus and influenza and RSV and all of those respiratory illnesses. Social distancing is still protective. And as always, wash your hands frequently. We wanted to talk a little bit about masking because we are asking people to adjust that a little bit. What we know about the Omicron variant is it's less droplet spread and more aerosolized. So that's part of why it's much more contagious. So when you do mask, if you're using one of those cotton washable masks, please double layers, or sometimes you can buy them that have a filter that you can place in them. If you are using a disposable mask, discard it after a full day of use, or if it gets wet. You want to wash your reusable masks, you know, just you can do it by hand with soap and water or in the washing machine. And the masks that have the ventilator, that little button on there, I understand it does make it a little bit easier to breathe, but what that does is actually expel anything aerosolized out of that. So it's not really protective over for other people. And so we would ask that you not wear them. And those are, just as a reminder, not allowed in the hospital setting. We are in the middle of winter here. One of the benefits maybe is those masks do help keep your face warm. But if you have a scarf or ski mask on, you can just put that over your mask. Facial hair can cause some issues with the fitting of your mask. So as close to your face as you can have facial hair to avoid gapping in the mask will be helpful. And again, it is necessary to cover both your nose and your mouth for those masks to work. And we are recommending not masking children under the age of 2, just because their age and their inability sometimes to clearly communicate if they're having some issues. Next slide.
So Dr. Nefcy, I'm going to ask you a couple of questions before we move on to Dr. Torney, just because you just gave a great overview of mask wearing tips. I was asked this morning by some of our clinical leaders and clinical staff if you could just reiterate what our current policy is in our Munson Healthcare facilities so that people can know what to expect when they're coming to seek care.
Yeah, thanks, Diane. So we still are mandating masking for all of our employees in the healthcare setting. So if you come to a clinic or a hospital, you will see every Munson Healthcare employee in a mask. We are also requiring masking for visitors. And the reason that we're doing that is several-fold. One, it protects our patients and our staff. We don't ask people's vaccination status when they come in, so we have no idea. We do ask that people are screened and not come to the hospital for visitation if they themselves are sick. But in order to protect our staff and our patients who are highly vulnerable, we do require that all visitors also wear a mask. Now, we will give you a surgical mask when you come in, just so that we can be sure that you are using one that has been vetted and looked at by our supply chain people, and not one that, like gaiters or cloth masks. You can certainly hold on to that, but we will ask you to put on a surgical face mask when you come in. And I would just remind people, hospitals are places where we have very vulnerable patients. A lot of them are very ill, don't have all of the protections that you might have on the outside. Many of them, have disease processes that make them more vulnerable. And so it's really our responsibility at the hospital setting to keep them protected. And so we have had a number of instances of patients not being willing to adhere to our rules about masking. And giving our staff a hard time about that. So I just remind people that that is a requirement, just like we don't allow smoking in our hospitals. We don't allow weapons in our hospitals. We also require right now masking in our hospitals. And so people who are unwilling to do that, we would just ask that you visit your family member or loved one outside the hospital when they are done with their hospitalization. But if you're going to choose to come into the hospital and visit somebody, you will be required to wear a mask.
Thanks, Dr. Nefcy. And just as a reminder too, we also offer virtual ways that families can connect with their loved ones while hospitalized. So thanks for that. And then one final question before we move on to Dr. Torney that just came in. Is Omicron currently in Northern Michigan?
It's a great question. I would say yes, it is. However, we send, the state right now is taking about 10% of all of the positive tests that are sent to them and sequencing them for the new variant and others as well. It's a very time-intensive, complicated, and expensive process. That's why we don't do it for all of the samples that are sent. And so because of the intensity and the time, it takes about 10 or more days to get the results of that. So any data that we have about where Omicron is and where it showed up is actually behind the reality. So when we hear that it's here in the state and understanding how contagious this particular variant is, I would absolutely say I 100% believe that it is here in Northern Michigan. We haven't had specifics for the sequencing in particular counties up here yet that I know of, but I do absolutely believe it is here and spreading relatively quickly. So that's where we're at.
Great. Thank you, Dr. Nefcy. If you don't mind, we will have you rejoin us after Dr. Torney's presentation for our Q&A session. So we'll have you back in a minute, Dr. Nefcy.
Thank you.
All right, next I'd like to welcome back Dr. Nick Torney, who is an infectious disease pharmacist with Munson Healthcare. And Dr. Torney, we've on previous press conferences had a lot of questions or heard about some of the new what we call oral therapies or COVID-19 pills that may be coming into the market. And we're happy to have you here today to talk about all of the current medications that are available and what we can expect to see. Welcome.
All right, thank you, Diane. And yeah, I'm excited to talk about a couple new oral antivirals that are for mild to moderate treatment of COVID-19. I will say that an ounce of prevention is worth a pound of cure when it comes to this disease state and many other viral disease states. We just have really limited options when it comes to treatment of viral infections, and COVID-19 is definitely one of those. So just reiterating that the vaccine is widely available, masks are widely available, and behaviors of social distancing are extremely important. And I don't think that we can rely on treatment options as much as relying on prevention strategies. So with that, we'll go to the next slide. So one of the medications that was recently authorized by the FDA is an oral medication called Paxlovid. You may have heard of this as the Pfizer pill. It has actually two medications in it. It's nirmatrelvir and ritonavir. So this is for treatment of, it was authorized for treatment of patients with mild to moderate COVID-19 in the outpatient setting. So not patients hospitalized due to severe or critical COVID-19. And the current eligibility criteria is limited to high-risk individuals, meaning individuals that are at high risk for progression to severe disease, which at this time it is people 12 years and older with moderate to severe immunocompromise, regardless of vaccine status. So patients that have had transplants, bone marrow transplants, or organ transplants, patients that have immune systems that are compromised in some way, either because of disease states, cancer, or medications that they're currently receiving. And also for patients that are 75 years and older that are not maximally vaccinated. So that would be patients, maximally vaccinated includes completion of all recommended vaccines for their age group, including booster doses. And it's recommended to start this therapy within 5 days of onset. And also the treatment duration is 5 days. So it's take these medications twice a day for 5 days. And one of the main things to note with this is that there are a lot of interactions with common medications that individuals take. And it's important that both the physician or provider that prescribes this, as well as the dispensing pharmacist, are reviewing current medications to make sure that there are no significant drug interactions, because the medication ritonavir can cause, that is the reason for this. And it doesn't mean that it's not safe to take this medication, it just has to be reviewed. So highlighting the importance of only taking this when prescribed, because taking this outside of that prescription and that review process could be dangerous. Next slide. And the second new oral medication that was recently approved, molnupiravir, is Merck's medication. So Merck has completed randomized controlled trials in patients versus placebo with this medication. And the treatment, again, is in the same population as Paxlovid with mild to moderate COVID-19, not hospitalized. And this is suggested as an alternative when either Paxlovid or our outpatient monoclonal antibody therapy is not available for treatment of specific populations. So Again, this is, this is 18 years and older instead of 12 years and older that we saw with Paxlovid, but still with the same moderate to severe immunocompromised status, regardless of vaccine status, the age of 75 and older, that's not maximally vaccinated. And again, the reason that vaccination status is important is because, as Dr. Nefcy noted, all of the patients that are intubated with COVID-19 are unvaccinated in Munson Healthcare. And so this population, unvaccinated elderly population, is at extreme high risk for development of severe disease. And because of the limited supply of these medications, we're recommending that they are only used in those patients that are at high risk for progression to severe disease. And lastly, age 65 to 74 years, not maximally vaccinated with a prior risk factor. And those risk factors are common diseases such as heart disease, diabetes, lung diseases, and so forth. So same thing, treatment duration is within 5 days from symptom onset. Treatment must be started within 5 days of symptom onset. Duration is 5 days. And it's very, very important that this medication is not prescribed to patients during pregnancy or patients who may become pregnant, because there is concern for fetal toxicity in animal studies. So this was noted in animal studies. However, we do not have data yet in humans. So again, this comes back to, don't take this medication if it's not prescribed to you, because there are screening and counseling points that provider and pharmacists have to go through in order to make sure of the safety of this medication for each specific patient. And I'll just end with noting that these medications, again, are in very limited supply right now. That's expected to increase as the months progress, but we're talking in our area, less than 50 courses, 100 courses of therapy that's available currently. And again, this is expected to increase, but we cannot rely on this therapy at this point in time to be given broadly. So, but that's expected as these things roll out. And I'm just excited that we have options in our community that are available for patients, and will be more available as time progresses.
Thanks, Dr. Torney. And it sounds like these are only for patients who are not hospitalized. Are there any new treatments for hospitalized patients?
At this point in time, there are not any new therapies for hospitalized patients. There are sort of optimization strategies for hospitalized patients. For instance, increasing steroid doses for patients that are critically ill and intubated, but no specific new medications. So, to reiterate your point earlier, an ounce of prevention really is going to go a long way still at this stage in the pandemic, because of the limited availability of these outpatient medications and limited options if you do get hospitalized, it sounds like. Correct. Okay, thanks, Dr. Torney. Now I'm going to ask Dr. Torney for you to stick around for the Q&A session and to welcome Dr. Nefcy back. We do have quite a few questions coming in. So the first one is, Dr. Nefcy, you mentioned that on your 2 slides of the positivity rates in the state versus Northern Michigan, and that we're seeing that the lower portion of the state is at a higher positivity rate now. Do you know, is there any reason why that is happening?
Well, I mean, it's certainly not unusual, and we've seen this with past surges, but what we know about Omicron specifically, and even with the Delta, but Omicron specifically, is that it's highly contagious. And so when you have a denser population, more people closer together, it's much more likely to spread and much faster in that kind of situation. So that is likely in large part what's happening there, is just the high density of population in the southern part of the state compared to where we are.
Okay, thank you. We are having a question here about when will the county health departments be reporting again? And as a reminder, the health department partners join us every other week. So we're hoping to have them all rejoin us again next week. We are getting a lot of questions about the availability of testing. So Dr. Nefcy, I'm gonna ask several questions of you related to testing. So I'll ask them one at a time. Are rapid tests being used to detect the Omicron variant? There was news that they were not reliable at all, but that the PCR tests are. And what about at-home test kits? Can they detect Omicron?
So I would say it depends. So there were a couple questions in there. One is the PCRs specifically, I can speak to the ones that we use here at Munson Healthcare, do detect Omicron. So the PCRs tend to be more accurate as far as identifying whether somebody has COVID or not. And the PCR tests that we have available throughout Munson Healthcare do detect the Omicron variant. The home tests or the antigen tests, I would say it depends. So you can actually get on the CDC website and find which brands tend to work better than others. I would just caution people, one of the issues that we've been running into, and this is not just about testing, it's about masks, it's about a lot of different things, is there were some people who are maybe less honest than others that took advantage of the supply chain issues and people's fear, frankly, and did make available masks and tests and those kinds of things that really weren't effective or didn't work as they should. So I think you need to be very careful and cautious about which tests you have. Certainly, most of the ones that are going to be available through a pharmacy or that kind of thing have been vetted. But if you're ordering from some online place and getting a test, I would caution that you might run into some issues. But if you're buying it from a pharmacy, you can certainly, or getting it from one of our pharmacy locations, you can certainly, I think, trust that. But you can get on the CDC website, and it's very particular about which brands are more sensitive and work.
Thanks, Dr. Nefcy. Along the same lines of testing, we have quite a few questions from some reporters coming in. So the first one is, why do you think there's such a large increase or demand for testing right now? Is it because we think people are experiencing minor symptoms, or is it because they need to get tested to go back to work or school or after the holidays? Do you have any idea?
I think it's probably a combination of all of them. I think we are seeing more sick people. We're seeing more people with symptoms. I mean, and we're not only in a pandemic, it's also flu season, it's also RSV season, it's kind of cough and cold season. So we are seeing more people sick, and we have been asking people, listen, if you have any symptoms at all, please get tested. And the reason we're saying that is because we obviously are trying to temper the spread of the coronavirus, and a lot of people have it. And so that's why the positive tests are increasing. So I think it's probably a combination of testing. I mean, certainly we've seen at our universities and that kind of thing, a requirement, if you're going to go to a sports event or that kind of thing, or people who are traveling, sometimes depending on where they are, have to have testing. So it's probably a combination of people trying to safely get out there and live their life a little bit more, but doing it in a responsible way, and people actually having some upper respiratory symptoms and being good stewards and good community members and testing themselves before they are around their loved ones or return to work or school.
Thanks, Dr. Nefcy. On a related question, is testing even worthwhile if the results are so finicky? For example, someone can test negative, then possibly catch COVID on their way home.
Well, that's true always, right? So yes, I think it's worthwhile. I do think, though, you have to be, kind of understand what you're doing with the testing. So I've even had members of my own family who are like, oh, I just found out I was exposed and we went and got tested. Well, they may not have even been truly exposed. Somebody they were with got notified that they were exposed. So, there's a timing thing on this. There's an incubation period. So, that's why when you look at the CDC guidelines of when testing, it's usually several days after you've had your exposure, so that you know that your body's either having a response or not, and that's how the testing works. So, again, you can get on our website, you can talk to your physician, you can ask our Ask a Nurse hotline, you can get on the CDC website, and they will actually give you some good guidelines about if you were exposed, what does an exposure mean? And if you were exposed, when should you be tested? But just because you know somebody who was exposed doesn't mean that you should go immediately and get a test.
Okay, thank you, Dr. Nefcy. This next question for Dr. Nefcy is Munson Healthcare seeing an overall increase or decrease in ICU patients, regular hospitalizations after the holidays? And are we seeing a lot of non-COVID related illnesses as well?
Yes and yes. So, I think we reported early on in the presentation that over the holidays, we'd actually seen a decline in our number of COVID patients specifically, but we had a little bit of a respite for, Christmas and New Year's. As of today, we are actually starting to see that trend back up. So we still are quite busy. We still have only a handful of ICU beds available across the Munson Healthcare system. So we are seeing high acuity, both increasing now again for COVID-19, but for other illnesses as well.
All right, thank you. We also have a question here about when will we be able to get at-home test kits in stores or online again? And I just want to remind everyone that as a healthcare system, we don't actually supply the test kits to local, pharmacies or retail stores. That is the manufacturers and the supply chain issues that I think we're seeing. And I think I don't really know when that supply is going to get better. Dr. Nefcy, have you heard any word on the supply chain?
No, just to reiterate that we continue to see supply chain issues. I know that the state and federal government are communicating with us that they are working very hard to try to get test kits out and available, not only through pharmacies, but through schools and other community centers. So I know it's something that they are working on. I haven't received an update, at least this week, of where we are on that, other than they're working on it.
Great. Dr. Nefcy, you mentioned earlier in your presentation that you were hoping Northern Michigan would get to a 70% vaccination rate. What is the significance of the 70%?
Well, I don't know. And Nick can help me out here. It's a little bit of a made up number, but when we talk about community immunity, or some people call it herd immunity, we know we need to have a certain percentage of the population immune against an illness to keep it tempered down and spreading through the community. So we had said 70% early on. Now this is getting a little sciencey, but that was with the original strain of the variant and how quickly it spread. It's actually probably quite a bit higher with the Omicron variant and how quickly that is spread. So when you have, it's similar to measles probably now, and you need actually a higher community immunity to prevent the spread of measles before you start to see flare-ups when that immunization rate goes down. So probably 70 probably isn't. I would say that's the bare minimum of what we would like to see for the community. It probably for Omicron variant specifically needs to be a bit higher than that. But there's just a certain percentage of immune people in our population, in our community, that we need to have in order to stop the kind of wildfire spread that we're seeing now.
Thanks, Dr. Nefcy. Dr. Torney, any further comments on that?
Yeah, just as the way that I understand it is that as the transmissibility increases, or the R naught, the percent of individuals in the community that are immune has to increase in order to reach herd immunity. So exactly what Dr. Nefcy had said, just put in a different way, in a way that somehow my brain tries to remember.
Thank you. And on a related question, because the Omicron variant is more highly transmissible, are we expecting that we will reach herd immunity faster because the Omicron variant will infect more people more quickly? So I think it's sort of a question about the natural immunity versus or prior infection versus vaccination.
Yeah, it's a good question. One of the things that we know about the acquiring natural immunity is that it's not as efficacious as the vaccine. And so some people that get the disease naturally don't have a strong immune response and are susceptible. The other kind of thing with that is the variants. So we know, as an example, people who had COVID-19 who caught the actual virus early on are likely not immune against the Omicron variant. There's just not that transmissibility between the two. So I hope so. I'll say that. I think if, not understanding how many people will likely be infected with Omicron, if that did transfer solid immunity, that would be great as another response. I'm just not 100% positive that it will. So fingers crossed.
Thanks, Dr. Nefcy. Dr. Torney, could you give us an update on the availability of monoclonal antibody therapy in our region?
Sure. So to give a little background on that, there are 3 monoclonal antibodies. There's Regencov, bamlanivimab, etesevimab, and sotrovimab. All of these have been limited supply recently, and only sotrovimab is active against the Omicron variant. We are able to still provide this therapy for patients in our community. We're constantly keeping an eye on this, and the state is doing an excellent job at divvying up this resource and allowing our community to still treat patients. So at this time, we are able to meet demand with that. But as we've mentioned, if Omicron does become 100% of the variant that we see in our area, that limits what monoclonal antibodies that we can use with just sotrovimab. And also across the country, everyone is in the same position. So of course there's going to be shortages. That's just realistic. So trying to again use this therapy in patients that are at most high risk for progressing to severe disease is most important.
Thanks, Dr. Torney. And this is, not sure if this is a question for Dr. Torney or Dr. Nefcy, but can you explain the science behind why some tests are less sensitive in detecting Omicron or even giving false positives rather than false negatives? Who wants to take that one?
I am unable to accurately speak to that one.
Well, it depends on what they're testing for. So, the antigen tests are typically sensitive to a particular antigen. And if you didn't make that, or if that's not part of the virus that you have, it's not going to pick it up. The PCR is actually testing for virus particles as well. So again, it depends. And you hear a lot about the spike proteins. Same thing with vaccines. It kind of depends on the overlap between the spike proteins and the number and what you're actually either testing for or immunizing against. So I don't know if that helps. The other thing that comes into play is how accurately. So I don't know if anybody out there, how many of you have actually had a COVID test? It's quite uncomfortable. They go pretty far up in your nose to get to swab and try to get what they're testing. And it's quite uncomfortable. And I would say many people, especially when they're doing it at home, maybe aren't going up as far or following the directions and turning the swab 5 times and doing both nostrils and those kinds of things. So if you don't get an accurate swab, just like when you do a throat culture, if you don't get a good swab on that throat, you're just not going to have enough of the what you swabbed for to get a positive test. I hope that helps.
Thanks, Dr. Nefcy. I think we're going to continue to get a lot of questions on testing, especially as demand increases, the supply of the at-home tests, and that is still a bit questionable right now. So, so I think, can we direct people to the CDC website or any local health departments? Where's the best place for people to get information on whether or not they should get tested and what type of tests they should seek?
I would say the health department is a great source for that. You know, again, we've talked about our Ask a Nurse advice line, but I think the health department probably is the primary place I would go first. And all our local health departments, our Michigan Health Department, and even federal agencies like the CDC all have really good information on their website about all of those questions.
Thanks, Dr. Nefcy. A couple more questions for you. And this next one is related to masking. In workplaces, what are your masking recommendations? And can you specifically comment on common areas, whether or not someone has an office with a door? What are the current recommendations?
So I am in my office with my door closed, and so I don't have to wear a mask. But as soon as I step out, if I want to get a cup of coffee, I need to put my mask on. So really in any place other than your office with a closed door in a healthcare setting, you are required to wear a mask. Common areas, walking down the hallway, even running across the hall to get coffee, got to wear a mask.
Thank you. And back to testing. If you test positive on a home test kit, should you confirm that with a PCR test, even if your symptoms are mild?
I'd say it depends on your situation in particular. So, you know, if you can work from home and that's an option for you and you have a positive antigen, I would assume it's positive and stay home you know, do your quarantine and masking and all of that kind of stuff. If you are, you know, required to travel or you're a frontline, you know, first responder or a healthcare worker or those kinds of things, you know, it might behoove you to do further testing, but it really depends on your situation.
And I think it's also important, I know our health department partners are not on this call today, but they have reiterated in the past that if you do test positive with an at-home test, you really should report that to the health department so that they can provide you with further instructions, and also your primary care provider should know so that they can help you navigate your particular situation. And as always, if you do have questions, you don't have a primary care provider, our Ask a Nurse hotline through Munson Healthcare can also help possibly answer some of your questions about that. Dr. Nefcy, how is the health system preparing for Omicron? Are we making any changes to prepare for an influx of patients from the Omicron variant? And how are we bracing for the weeks ahead?
Well, we are. That's probably a good word for it. We're bracing for it. You know, I think that we've acknowledged this respite and used that time to prepare as much as we can. You know, trying to get some surgeries in, as an example, that might have been delayed prior. We have been taking a very good look at our visitation policy. We are right now working on aligning our quarantine for employee approach with the CDC's guidelines and our OSHA requirements and all of those kinds of things. And we've also started offering KN95s to our frontline employees or patient-facing N95s. But a higher degree of masking is being offered to our employees. Again, we have some OSHA requirements and other rules and those kinds of things that, you know, right now that is a recommendation and not a requirement. But understanding that the nature of this particular variant is likely to be much more airborne and aerosolized rather than droplet, we have been providing a higher degree of PPE for our staff. I will say that those on the front line that are taking care of COVID patients have already had that very high degree of PPE required for them. But those are some of just examples of some of the things that we are doing. We're also really stressing for our staff the importance of getting boosted. I think everybody's aware that we do have a vaccine mandate now in place.
Thanks, Dr. Nefcy. And I do not have the current numbers here, but the question is, how many of our staff are out on quarantine in the healthcare system? And how are we handling the isolation of workers? You just mentioned something about the aligning our policies with the OSHA and the CDC recommendations, but I don't think we have current numbers on how many of our current staff are in isolation right now.
I don't have those numbers. I know there are some. Certainly it's something that we look at and report. We are hearing of pretty high numbers downstate in southeastern Michigan, where they're seeing probably more of the Omicron variant than we are at this point. But yeah, we certainly are aware and are looking. I think that's really why the CDC made the recommendation, because it's not just healthcare, it's other places that have staffing issues with this, and adjusting the policy so it's not necessarily 10 days, but if you're asymptomatic or you have a negative test, and you're masked, you can come back earlier and that kind of thing. So that's what we're looking at, but obviously we have to follow the MIOSHA and OSHA rules. Those are rules. The CDC's recommendations are guidelines.
Thanks, Dr. Nefcy. Any other final words, Dr. Nefcy? I think you wanted to maybe restate or reiterate something about the natural immunity.
Yeah, we do hear a lot about people concerned that we don't emphasize enough that you can become immune by having coronavirus naturally. And while that may be true, we also understand that there's high risk of getting that disease. So it's so much more safe to get vaccinated against coronavirus than to have coronavirus. We really don't have a good way to predict who's going to have a rough course of illness. We have no way to predict who's going to develop the long hauler syndrome, or even knowledge of what could potentially be in the works downstream, with time of having natural disease. So while I am hopeful that those who are unfortunate to get it, that they do get immunity from having disease, the preference would much more be on the preventive side. It's safer, it's certainly cheaper, whether you're doing the cost or missed work or whatever it is, or the risk to the community. Vaccine is just a safer, cheaper, better option than getting the disease itself.
Thank you, Dr. Nefcy, and thank you, Dr. Torney. We really appreciate your updates this week. We are unfortunately out of time. We were not able to get to all of the questions today, but we will update our website and we'll bring up a couple more slides here just to end. But again, I just want to thank Dr. Nefcy and Dr. Torney for their time today and valuable information that they shared. As a reminder, we also have a lot of other community resources that we like to point you to. There's the vaccines.gov website. There's the 211 Michigan hotline and website. There's the Area Agency on Aging of Northwest Michigan, and all of our local health departments. And again, our health department partners will be back next week to answer a lot of the questions that you have, and specifically we'll ask them to comment on their testing availability and current, and obviously what they're seeing related to Omicron. Next slide, please. As a reminder, our current testing resources, and there we go. The current resources that we do have in our region for testing are the local health departments. You can check with your primary care provider. Walgreens, Rite Aid is still having them testing options. You can go to michigan.gov/coronavirus to find a testing site. Call the Michigan COVID-19 hotline, or again, the Munson Healthcare Ask a Nurse hotline is available. Next slide, please. And as always, we invite you to sign up for our biweekly e-newsletter, follow us on social media, and visit munsonhealthcare.org for the latest information. So again, thank you everyone for joining us. Again, Happy New Year. We're looking forward to a better 2022 related to this pandemic. So lots of optimism with some of the new oral therapies that Dr. Torney mentioned. So we'll continue to keep you updated as we learn more, and we'll see you again next week. Thanks everyone, and stay safe and healthy.